Sir, we are here at the Medanta Clinic, which is next to the main hospital. How you are planning to expand it in other cosmopolitan cities? Because we know that the illnesses, the kind of illnesses in cosmopolitan cities are little bit different than other illnesses and other small cities.
So as far as Medanta is concerned, we have always looked to go to the areas where healthcare of this standard and the quality which we provide is needed the most. We have never looked at cosmopolitan cities or what is commonly referred to as tier 2 or tier 3 cities. We have always looked at going to where the care is needed the most. And if you look at Medanta's footprint, of course it is more in the northern part of the country because of the fact that we started in this area. But we moved to Gurugram, one of the first few hospitals there. We have 1,500 beds in Gurugram. We built out a 1,000-bed hospital in Lucknow when people were saying that Lucknow cannot sustain a 1,000-bed hospital. Now we see many other hospitals chasing us into Lucknow. Similarly, we have a 650-bed hospital in Patna. So our mission has never been to be only in the cosmopolitan cities. We have, of course, a hospital which is planned in Mumbai as well, and we have 2 hospitals which are coming up in Delhi, and we will soon open our hospital in Noida. So as far as Medanta goes, we're in Ranchi, we're in Indore. We have always looked to go where the population needs the care. Of course, you have to keep in mind where doctors are available, where you can find the right land, and more importantly, we are focused on delivering a very high standard of quality. So we are not chasing a number of beds, we are not chasing to be in every city. Wherever we go, it should be the best and it should be the highest standard of care. We do want to augment our hospitals with clinics. We do intend to have supporting services, and it's not only clinics. We provide home care services, we provide lab services, we provide, in this facility alone in Golf Course Road in Gurugram, we will have complete range of diagnostic facilities, MRI, CT, etc. as well. So our mission has always been to be able to get closer to the patients and provide this standard and this quality of care. And hopefully we will be successful in this, and we will continue to expand on this mission.
We know that Medanta is a gold standard in hospitals and certainly in private hospitals. You also mentioned a little bit about integrated health treatment, whichever is good, whichever suits an individual, a patient, that should be integrated. That is a very positive sign, because I know IMA is at war with the alternate medicine. So that is a very positive sign.
You see, there's a lot of self-interest and there's a lot of noise around the system. I think the most important part of this is that we should be focused around adequate science, adequate correct information, because there's a lot of misinformation, unfortunately, also. There is a lot of fake news, there's a lot of fake medicines. People say that if you have this medicine, you can get rid of coronary artery disease, or if you have this medicine, you can get rid of prostate cancer. These are nonsense things and they should be cracked down upon. This is actually illegal activity that is happening. However, there's a lot of very, very powerful knowledge in our traditional therapies like Ayurveda. There are a lot of treatments, especially if we integrate them with modern medicine, that we can actually provide a lot of benefit to patients. And we can do it in a much cheaper way and a much less invasive way. So the important thing is not to be dismissive of one type of science or the other. The important thing is to actually study these, work together with the scientific community, with the research community, with the clinicians across all spectrums, and actually put forward the right kind of practices. Nothing is right or nothing is wrong, and in healthcare everything has nuances, everything has very cautious and concerned approach. So the right way to think about it, and that is the way that Vedanta follows, is to put the science before the noise. And if we do this, then there's definitely benefits in integrating various types of therapies to be able to provide the right kind of care for our patients.
So there is a plant-based medicine. They don't find on the rack as a medicine. Do you see that there should be canvassing on that at the health ministry level, so that plant-based medicine also get the same recognition on the shelf as a allopathic medicine? And what you endorse also is that we should look into the holistic health.
So you see, again, we can't be take such a sweeping statement to say plant-based medicine is good or plant-based medicine is bad. I think that you have to look at it on an individual case-by-case basis. Now, the ministry, we have the Ayush ministry, the health ministry, they are very aware of these things, and they are trying to work with industry, with practitioners, to actually put forward what's the right rationale for this. Even some of the research institutions are doing this. What, however, needs to happen is that we need to make sure that it's being done in the right manner with the right practices and the right protocols. Unfortunately, historically, the traditional therapies in India have not documented, have not published research, have not done a lot of the things that modern medicine is more familiar with. And definitely we need to get our modern medicine practitioners also more aware of some of the benefits in traditional therapies. So I won't say that it's not being done, and I don't think that we are yet there. We have a long way to go. And again, it's not only traditional Indian therapies. There's a lot of benefits in Tibetan medicine, in Chinese medicine. There are remedies around the world. We have the opportunity in India to study these across systems and look at how can we provide a better quality of care, not just for India, but for people from around the world. There is no reason that this integrated medicine cannot be the medicine of the future, not only for India, but for the whole world.
So quantum and AI are too much talked about when we talk about the big magnitude of data, whether it is in medicine or whether it is in healthcare. What is your perception and your understanding about it, and how we can bring this, marry quantum and AI for a country like India or China or other countries in the Middle East, where where we have a lot of big number of footfalls in patients?
So it's already happening. AI and computing and generative AI and artificial intelligence, these are lots of buzzwords that keep getting thrown around, but it's already happening. If you look at us at Medanta, we're already working with partners to do AI-based X-ray screening. We've been using it for some of our TB screening programs along with the government of Haryana. There's already a lot of work happening on ophthalmology screening with AI. There's work happening in the cancer arena around AI, not only with respect to data and understanding data, but also with respect to genetic therapy. So there's a lot of work happening. The challenge, unfortunately, in healthcare is that we require lots of data, and we require this to be actually put into standardized and robust protocols that actually can be put forward before we start using it in patient care. We also have a challenge that a very, very small percentage of our data is captured in electronic records or in systems, and even when it is captured, it is not necessarily in an analyzable form. So while Medanta, of course, has electronic medical records, if you look at all the providers across the country, both big and small, there's a very small percentage of this information is actually captured. With increasing use of technology, with increasing use of various techniques, including things like audio-based data capture mechanisms and real-time kind of analysis around these things, this will improve. I do see it as a very important part of care, but it will take time. And it is not like it is going to replace clinicians, it is going to replace what we do today. So I don't think that you will anytime soon have medical care being administered by a computer without a doctor present. But you will definitely have these as tools that will help doctors get better at their jobs, get more efficient at their jobs. And as long as we actually work with clinicians and make sure that we are always keeping the sanctity of the doctor-patient relationship at the center, I think these are all very positive developments, and they will only increase and they will only get faster.
If I may ask one last question, a proton therapy for cancer, do you think that that could be more widely made available across South Asia? Because this is one of the prone area across India and around the 7 countries or 10 countries in maybe Southeast Asia including.
So, proton therapy has a variety of very positive uses. Very specifically, it's been shown to be more beneficial in some of the pediatric cancer care and pediatric cancer treatments. Unfortunately, the therapy itself is extremely expensive because it is expensive to set up the complete equipment for us to be able to treat this, and you require lots of space, you require because it's a radioactive therapy, so you require lots of precautions, etc. around it. So there's a lot that goes into actually putting up these systems. Now, in the years that have passed, even in the last few years, we've seen the prices of this equipment fall drastically, and I'm sure it will continue to fall. We also have newer therapies that are coming on board associated with how we treat cancer. So I think that this will come. There is, of course, a need for us to be able to provide a greater standard of care across the board, and there's also a need for us to increase our research, development, and manufacturing of all these types of equipments within the country. And like I said, this is not just something that's required for India. This is required for the whole of Asia, Africa, Southeast Asia. So it's very much required, and I think you will see that this will reduce. But of course, we are in a race to see that we can get the costs down as fast as possible, because every day we are facing the challenges of increasing burden of cancer.
Thank you.